So, I am back in the office. I am no longer on the bed. It is 9:20 and this is my first recording not on the bed, but I actually moved the whole computer back and everything to my desk probably on 9:18. It might have been 9:19, but anyway, the point is yay, I am able to sit at a desk and be up and about and all that jazz, and no more being on the bed. Um, I didn't realize how much this window over here casts like a shadow on my face, though. I feel like I'm Two-Face. I wouldn't make a very good villain. Um, but, anyway. Um, Yesterday was my appointment. I waited and I didn't record on the 18th because I knew on the 19th I had my first appointment, my consult for the hysterectomy. And basically, it went good, I guess, for the most part. Originally, they told me I only needed a doctor's letter and a therapist letter, but now they're saying for the actual surgery itself, I need another therapist letter, so I have to talk to my therapist about that tomorrow. That's what I thought it was from the beginning, but they said, oh no, you only need the one. And so I was like, maybe it got changed or something, or it is different in this, state than it is in other states or something. But no, no, what I originally thought was true. You do need two different separate therapists to write you a letter, as well as your doctor's note. Um, oh well. Is what it is with that. But the big thing is they said I don't have to have like a external ultrasound or an external examination to go ahead and have the surgery. They said that it is very likely that if I have any um, gonads or prostate or anything like that, that it's not part of the system that creates your menstrual cycle, and the systems that are making your menstrual cycle are what gets pulled out during a hysterectomy. And they said that even if they did encounter an organ somehow there, but it just hadn't been like part of the system, that they could leave it in and it wouldn't really be an issue unless it had like malformations on it or something, like tumors or something. Um, Polyps maybe, I don't know. Anyway, the point is it's very exciting because that's big to me. That's really big to me. So if my testosterone levels are being, pushed by some sort of internal organ, it's there's a high chance I'll get to keep it. If it's not, then that means that I may have a thing called congenital hydrenal hyperplasia or whatever. It was the thing that the very first doctor mentioned way, way back when. It's almost 10 years now ago that he brought up that he thought it was either intersex, that, or a very low chance of PCOS. And it's funny that it's coming back up again. But basically, if I don't have, like a prostate or a gonad or, something like that going on inside of me, then the next option to investigate would be that. But she said that we won't even worry about that or look at that unless we need to. She said a lot of health problems do come from that as well. And so it could be that, the health problems that had my whole life weren't necessarily just from being cut. Apparently, being cut can affect your hormones for the rest of your life, but that's almost exclusive to boys who are cut. So if, because I obviously I was there, but I was a baby. If when I was born, when I was cut, if it was not because I had an external sex characteristic they wanted to get rid of, but maybe because they were just trying to do a more traditional female genital mutilation, whatever was going on there, whatever reason that they did it, is more figure outable. Um, because of the surgery I'm about to have. Because they can just look while I'm under instead of having to do like an examination and do invasive things and external ultrasounds and stuff while I'm awake. Because an external ultrasound isn't actually fully external. Yeah, it's called an external ultrasound, but in actuality, there's still stuff they put in you. I think I've mentioned it before when I took um, Peaches to go get a external ultrasound. It was like, oh, they still stuck something in there. So I was very worried about that, and none of that has to happen anymore. She actually said that because my surgeon does a lot of surgeries at the same location, if we can get my hysterectomy scheduled at a time when he would be there and he could probably step in for a couple of minutes and do a quick examination of my outer genitalia for the future surgeries anyway, because it's a little odd because of having been cut and the way that bottom growth didn't happen, but something did happen. So it anyway, um she said that I definitely should still have all of my nerve, that when they cut, they only cut off the end of stuff, whether it's a girl or a boy, and there's still nerves buried deep under the skin, and that's the nerves that I feel. That's not anything to do with anything in the vulva. Um, I there is only pain. There is nothing else. And it is abnormally small, which was part of the reason she wanted to avoid a physical examination, is because basically it would be highly traumatic. Um, the other thing is apparently for metoidioplasty, you would normally go ahead and do the hysterectomy but leave the vaginal canal intact. And so you would take out the uterus, you take out the ovaries, and you take out the little branches that go out to them and everything. And you just pull all of that stuff out, but you'd leave the vaginal canal because they use that for part of the creation of your urethral lengthening for metoidioplasty. But for a phalloplasty, which is what I want to have, since they're getting the donation site from like an arm or a leg or whatever, they don't want the vaginal canal to be open at all there. And so I'm thrilled with that. I would much rather not have. I mean, the opening I have is already deformed and too small anyway, so I am thrilled that they just want to close it and call it good. Because in my own feeling, I shouldn't have ever had one to begin with. That's what I feel like. It doesn't work right. It's not functional. Even when I had periods, they were horrible. They were very irregular, and they were very. Um, Sometimes you just flood and flood and flood, and then sometimes it'd just be like almost nothing, and it would be so oxidated, it'd be almost orange, and then sometimes, I would be like bedridden because of the pain, and then sometimes instead, I think because it affected my anemia that I have, I would just pass out, and I would just like literally fall over, pass out, and be asleep. It was very difficult, um, to go through all of that, and it's I. I started puberty when I was 7. I started getting body hair everywhere and stuff. I started my period when I was 8. So it's like um, not the greatest. She said that me starting my period that young definitely shows a hormone issue, um, that would have been presenting itself, and I did know that already, but I guess it was nice to hear her say that or whatever. I don't know. She's saying the same things that I've been told a lot. She was like, whatever. Uh, I want to take from it, that I have sensation in my chest after this surgery, and I never had sensation before in my life, is actually a really good sign. Um, and that getting rid of deformity seems to actually free my body up to um, acting in a more normalized, healthier, however you want to say that way. So she said that's a really good sign. And I was like, well, I'm trying to not get my hopes up too much because I know different body parts work differently. And she's like, yes, but all of this involves your skin. So I guess that's good. She was very nice and she did not touch me. And she was very glad that I explained my fear of doctors and stuff. I was very anxious. My blood pressure is usually like 108 to 112 over something, and it was like 135 over something. I was very anxious, and the nurse was like, "It's okay. You're allowed to be scared. It's fine. You know, this happens." Um, but like I was facing like one of my biggest fears going there. It was funny though. She's had a lot of experience with, the LGBT plus community and a lot of experience helping apparently women who have had female genital mutilation done to them because they grew up in say like Africa and things like that where there's still a culture that supports that kind of behavior, and she's also worked with intersex people before. So she's actually got a crap ton of experience doing that kind of stuff. And it was interesting to me because she she kept every time I would be like, "Oh, I'm sorry. Oh, I know this is I just have to be weird or inconvenient." She'd be like, "You no, don't apologize. This is my job and you shouldn't have to feel like you have to substantiate your existence," kind of an attitude, which was very nice. Like, it was very helpful to feel like she was going out of her way to show her personal beliefs about that a person should just be allowed to exist. Like, I told her that I did the extra therapy work so that I could have it on my insurance record that my gender dysphoria was not due to childhood trauma or any external conditions, that I did the extra therapy work. And her, oh my gosh, she's wearing a mask because, we're at the office and stuff. Wearing a mask, and still you could see how red her face got. She's just like, what? They made the what? How dare they? Like, she was so. She was like, you should never have to ever validate yourself. You are valid. Like, she was very, she was very offended on my behalf or whatever, and I was like, well, it's just for psychological reasons or whatever. I treated a lot more gently or whatever. Or at one point, she was, I didn't bring up, all I said was I grew up in some domestic violence and some religious extremism. I didn't go further than that about childhood abuse stuff, but I did say something horrific happened with my mother present with a doctor when I was like 4. And anyway, the point is I didn't explain that all I said is it might have been at that time I got cut, or it might have been when I was a baby. I don't know. I don't have the answer to that. Anyway, she was and my girlfriend was there to be supportive because she knew how terrified I was. But also she could collaborate that my genitalia looked very different before testosterone than it did after, but it wasn't bottom growth. It was because it split open, like my skin did in a vertical line. Anyway, um, the the doctor, I was trying to make her feel a little less offended on my behalf or whatever. I was trying to make jokes. And one of the jokes I tried to make was, I was like, oh, I first asked for a hysterectomy when I was 18, and they told me to come back when you're 40. And I turned 38 in October, so I'm not quite to 40 yet, but hopefully we can fudge it. And she's just like, I am so sorry they said that to you. That's so stupid. And I was like, well, it was normal standard at the time. I kept trying to say that because I felt like it did need to be recognized that normal procedure at the time for a, a baby who came out weird was to cut. Normal procedure at the time, if a parent complained about their child being too different or too sexual or anything like that, was they cut the kid. Um, Normal procedure went way back in the days when I was born, which feels a little weird to say, but whatever, that was standard procedure, and they've moved away from that intentionally because it's been found to be so detrimental. But they hadn't found that out at the time. Anyway, she um she seemed very intentional in making sure I knew she wasn't dismissing anything about what had happened to me or how could feel about it or something, giving me space that it was okay if I was upset. Um, which most doctors don't want you to be upset in their office. I think it helped me not have any kind of escalations of my own anxiety of just being with a doctor who was an OBGYN, like the doctor I am most, the kind of doctor I am most terrified of, you know? And she was super nice, like very, very, like when we left, my girlfriend was like, I almost want her to be my OBGYN. She was like, I mean, I have this really highly recommended one, but man, this lady was good in her opinion. So, um, that was helpful. That was very helpful. As far as the surgery goes, she said that technically this will be considered stage one because not only will there be the laparoscopic hysterectomy, but also the closing of all of the vaginal canal and everything. Since I don't have periods anyway and all of that, it doesn't matter. She said since I have to be on testosterone the rest of my life, her recommendation was to not leave an ovary, and I was like, that's what I had already been thinking anyway, because I'm already gonna have to be on hormone replacement for the rest of my life. If I go off of hormone replacement, then I can run the risk of getting sick again, like I was for almost my entire life, and I don't want to go back to that. I don't want to go back to being the mental health problems like depression and suicidal ideation and constant insomnia issues and just horrible mental health stuff. The chronic depression's the biggest one. Well, I guess suicidal ideation should be the biggest one. But I had over 35 years of non-stop, chronic, every single day depression, and that feels bigger to me than the suicide attempts, even though I have over 100 that I attempted when I was younger. Um, I feel like those wouldn't even necessarily have happened, or maybe I'd only have like one or two times if it wasn't for the non-stop depression. And obviously the abuse, the gender dysphoria, the being demonized for existing, like the religious scrutiny and the perfection expectations and the having to parent my own parents and like there's a whole skew of things that added to my mental health issues. But the chronic depression, waking up every single day and being sad that you didn't die in your sleep is just like I don't want to ever go back to living in that completely soul crushing way. And the truth of the matter is, even if they left in the ovaries, I could never go off of testosterone because I would still have to go back to that. And I don't want to. But even besides that, there was all the health issues like my bone loss and going back to having asthma again. Who would willfully choose to go into early onset osteoporosis and asthma and early onset like stages of arthritis and have your teeth go back to disintegrating partially in your mouth because you have a pH imbalance in your mouth and go back to having near you know having vision issues so bad with sunlight that you get blindness, like and are scared that someday the blindness won't go away. Like I, there's so many things that improved in my health tremendously from being on testosterone. I don't want to ever go off of it. So Yeah, that's sort of a foregone conclusion that yeah, I take out both the ovaries because I'm gonna have to be on the hormones anyway, and this way it's safe to just close everything up. I never have to see an OBGYN again after the surgery, and it's a done deal. Like it's what makes the most direct, straightforward sense. Um, the surgery itself, they said is most likely going to be at some point in November, as long as I can get the letter going, the full letters arrangement going. That is supposed to be there, and that's what originally I had been told by the surgical assistant coordinator lady for my personal surgeon for my stuff, and so that puts me all going forward on the correct path and pace. My follow-up surgical examination for my top surgery slash in-person bottom surgery consult with my surgeon is officially scheduled, and it will also be in November. Well, okay, I don't know for sure that my hysterectomy would be in November. It's not actually scheduled yet, but the most likely scenario is that it would be in November. Um, it could technically be December or January, but she said it also technically could be in October. So she said, but the most likely thing would be November. So I'm going with November because that's what she said was most likely. I don't want to get my hopes up about her saying, oh, it could be in October if the highest odds is November. If it happens to end up in October, that would be neat, but it could also end up in December. So I'm just sticking to November. Anyway, um, but I do have scheduled, it is on the books, my follow up consult slash bottom surgery consult will be on November 4th. So October 14th is my virtual bottom surgery consult, and then November 4th is my in person consult slash follow up. So things are moving along, and that's awesome. I'm so excited. I Oh my gosh, I am so excited about all of that. And there's a lot of my life that I haven't felt like I was quote unquote winning in, and haven't been feeling very, great about myself, about a lot of things going on in life. But I am starting to do better with a lot of that. I found I found a thing that helped me get some understanding because I wasn't going to be getting any closure about anything from who's involved, so I instead at least can feel some semblance of closure from understanding some of what was at play in the situation and realize that there was literally no way to avoid it. Like I tried so hard, and I kept feeling like, did I try hard enough? What did could I have done more? Could I have somehow magically made things different? Well, I'm supposed to have been on bed rest and, in recovery from a surgery, and in actuality, it was inevitable, and I had actually been delaying it for years by basically throwing myself away and abandoning myself all the time. Um, and I had to come to terms with that and try to accept that. And I am trying to quote unquote move on a little bit, and pursue myself, but pursuing myself has been a difficult thing for me, and quote unquote moving on is difficult because of the lack of closure anyway, but it's made more difficult because I struggle so much with thinking about myself instead of other people. And that's not because I'm like lacking in selfishness or something. That's not a noble trait. It's gone by multiple names like white knight syndrome and rescuer personality and blah blah blah. Yeah, it's a problem. It's not a, oh, I'm so much, more holy than thou or whatever. Because I always think of everyone else. It's actually a really negative thing. um, and it's not very abnormal for how I grew up. Apparently, it's extremely normal for how I grew up. Um, that can also be, exemplified by the fact that literally all of my siblings suffer from the same issues because of growing up with our birth mother and the way that growing up in that way works out. It just is an unfortunate result. Um, that that it just happens when you grow up that way, apparently. And the habits that served me in that survival situation are detrimental to me now that I'm trying to like live a life that's not just mere survival. And that's a difficult thing. It's a difficult thing to try to change your instinctual compulsions. Like it's a very hard thing to try to get something out of you that's been like ingrained in you for decades. Um, I'm trying though. I'm trying really hard to work around things, and I'm trying to do things with like family and I still haven't really talked to anybody about stuff, mostly because I really, really do not like talking bad about people. Um, Maybe someday I will get to a point where I can do that more. Like, I haven't even told my best friend. Like, it's literally 5 people that I have talked to about it at all. And one of them's my therapist, and one of them's my girlfriend, and one of them's my brother, one of them's my sister, and one of them's my sister's husband. And that's it. Not a single other person. Um, it, I, I haven't even talked to my brother's wife about it, even though I know she knows. Um, I just, I've had my dignity bashed and battered enough times. I don't like doing it to other people, even if it's just like stating what happened. If someone could see someone in a negative way, I don't like to do it. Um, I realize there's a difference between being open and honest and bullying, but it still feels bad to me, and I realize part of that might be more, you know, of the unhealthy white knight syndrome shit. I realize that's possible. I just really struggle with that kind of stuff. So the other problem is I'm not exactly the most social person. I don't like all my personal stuff to be poured out on people anyway. I don't like being an emotional burden on people. Um, I don't like emotional gurgitation. Um, so it's hard for me to talk about stuff like that's really deep and dark and like that with people because it makes people uncomfortable. And I don't like making people uncomfortable. It makes me uncomfortable. I don't like being uncomfortable. And it just feels like complaining. And complaining is something I don't like at all. So and I realize there's a difference between having a heart to heart and having like real feelings or whatever and I realize that it comes across as having no defense because I'm not defending myself or something, but I just can't care that it could end up more detrimental for someone else is worse to me than if something is detrimental to me. And again, I realize that's not healthy. I am way too tolerant of deviant behavior, and I know that's an issue. Um, but I can only work on things as as much as I can work on them, and accept things as much as I can accept things, and it has to be at the pace that it has to be at. Because I process at the rate that I process. And it takes years to become a way, and I genuinely feel it takes years to undo a lot of that. It's just part of learning about yourself and growing and stuff. But I think as difficult, as tremendously difficult as tackling gender dysphoria and dealing with a, lifetime of depression and dealing with, transition and all of that has been to get to, I feel like I had to do those things first so that I could ever attempt to address my personal and interpersonal issues that are like internalized. Um, my relationship with myself is pretty much like pure neglect. Like, um, and I am trying to come to terms with that and accept that and do better about that. And it's a lot. And that's that. As far as transition goes, though, um, I've still been doing good with my testosterone and all of that. I still haven't had any other like physical changes or whatever. I did a little bit of exercise this morning. I'm gonna try really hard now that it's past the 18th to exercise a little bit each day. I'd really like that. Oh my gosh, this weekend, we got the apartment all cleaned up everywhere because it turned into a disaster while I was bedridden because I'm usually the one who does all that stuff. And I can walk around in the apartment and breathe instead of it being like just cat hair and cat dander and then dust and debris and clutter and it just filthiness, and now everything is much more sanitary and the air is clear and it doesn't feel like we live in a polluted pig pen. And that's a massive relief to me. I hit the 18th and I was like, okay, first type of exercise I'm getting is cleaning this entire place top to bottom. Like I wanted couch cushions moved. Like I vacuumed the cat trees. Like I went all out with stuff. Like I was like, we got to get this done. I am so sick of this. And it is so refreshing. It is so nice. Oh my gosh, it's so nice. I don't know. I take a lot of value in being able to take pride in where you live and how you live. Like your home is supposed to be a haven. It's supposed to be when you get home, it's this comforting little nest where you get to cuddle in and be cozy. And it's not supposed to be this oppressive place that you're constantly wanting to get away from. If there's anything my childhood taught me, it's that. So it's a relief to be in a much less oppressive feeling environment. There are still piles of stuff. Some of it is stuff that I can't do anything with because the person who owns it all hasn't said what they want done with any of their stuff. So there's big piles, but it's at least consolidated into a pile instead of just being haphazardly scattered everywhere. Is a lot better for me personally, for functionality's sake. So, um, yeah. For the surgery, um, it's supposed to have a 2 to 4 week recovery time for the hysterectomy. Um, some of my trans friends said that their hysterectomy they got over it in like 3 days, and then my doctor said that she's had patients before who needed the 4 weeks, like the full 4 weeks. I have no idea what I'm gonna need or what's gonna happen with me because that seems very like a pretty big window there, 3 days to 4 weeks. So we will see what happens and how much recovery I need and all that. Um, I'm still wearing silicone tape on my chest. Supposedly wearing it as long as possible is a good thing, but once this little, roll of it or whatever runs out, I probably won't be wearing it anymore. And I am assuming that's going to be in like a week or less. So, because it's unfortunately expensive and I be poor. But at least I got to have some at all. Because I do definitely, see that there's been lots and lots of not just recommendations from other trans people, but, like r- written down results for silicone tape and stuff on scarring. Um, and then obviously in between wearing the silicone tape, which isn't very much, I basically take a shower, put some lotion on, and then when that dries, then I go ahead and put on the silicone tape and I leave it on until the next time that I shower the next day. Um, I was reusing the tape 3 times and it just was not staying on very good. So then I changed it to 2 times and that's been working a lot better. It sucks because I was trying to get as much money's worth out of it as I could with the 3 times, but it just did not really work. So that's too bad, so sad. Um, it's still working out better than I know some people get. So I'm really appreciative. I'm really grateful. I can't believe I lucked into this surgical team the way that I did earlier this year. Like, I literally got in a month before they stopped taking new patients, like, except 2 days a month. Like, I don't know how I got so freaking lucky. I am super grateful though, just so grateful. Like this OBGYN was deserving of all of the rave reviews that my personal surgeon gave her. Super, just really, really good. Um, and like I said, once I get past more of my surgery stuff, I will go ahead and give the names of the surgeons and my doctors and stuff that have helped me get to this point, so that hopefully people in the future can use them too. I just want to make sure that I'm on the schedule and that my surgery is in place before they get flooded with people. Not that I get enough views that they would be flooded with people from me saying it on here. I just don't want to take the risk because I already had some difficulty with scheduling before and it kind of made me wary. um so anyway, yeah. But I will eventually do that. I just yeah. Um, I have not been going to my trans support group. I need to talk to the leader, and that means talking about the rest of my life that I haven't really been talking about, and so that would be difficult for me. But at some point, I do need to do that because I need to send the binders to donate for other people to use for free. So I have to talk to him about that anyway. Yeah, because, I would like to be able to pay it forward or whatever, that people have helped me and I would like to help other, trans people be able to live their best life too. um, anyway, I gotta do that. It's just uncomfortable. It's very uncomfortable. Uh, anyway, I guess that's pretty much all I was gonna say for today. Can't really think of much else. So, thanks for watching.